As a neonatologist, I feel it's really important to combat disinformation in the internet. What you're looking at here is a baby with jaundice. Jaundice is extremely common. In fact, it's probably one of the most common things we see in the newborn period. One of the reasons that it occurs is because babies have a shorter half-life of their red blood cells, so they're breaking down faster. Their livers are immature. And while their feeding is being established, they may get a little bit on the drier side. So their bilirubins tend to be a bit higher. Many babies don't require treatment for jaundice, but some babies have to go under phototherapy lights. These are the blue lights that you may have seen, and they're quite effective at reducing jaundice. Back in 2016, though, some fears developed due to a concern that phototherapy, or that blue light shown just above my head, could lead to cancer. In 2016, a paper done by Rami demonstrated that the blue-green light that we emit to treat phototherapy is associated with increased rates of DNA methylation. Now, DNA methylation is a marker for DNA damage. So the more DNA methylation you have, in theory, the greater the rate of DNA damage. The theory behind why cancers form is that when DNA is damaged or cells are damaged and they repair themselves, during that repair phase, something can go wrong and that can lead to cancer. In 2020, however, another paper came out specifically just looking at narrow spectrum blue-green light, and that paper refuted what Rami had found back in 2016, suggesting that the type of modern phototherapy lights that we use do not increase DNA methylation and therefore, again in theory, should not place a baby at increased risk of malignancies. Abdellatif et al. In 2023 released a paper that looked at all the papers that had looked at cancer risk and found a couple of concerning things. The risk of any cancer, and specifically any childhood leukemia, was slightly higher when you looked at all the studies combined. Does this mean that phototherapy causes cancer? Well, this is where you need to have some caution, because this is an association. What it's suggesting is that children who have had a history of needing phototherapy may have an associated mild increased risk of having cancer as well at some point in childhood. Does this mean that phototherapy causes cancer? No. As the saying goes, association does not prove causation. Now let's say that we say for the sake of argument that there is an association. What does that mean? Another paper tried to quantitate this risk by looking at a very large population shown above. And what this study found was that the projected number needed to harm was over 10,000 to generate one additional child with cancer. So what that means is that over 10,000 babies would need to be treated with phototherapy in order to potentially have one more childhood cancer. To make sense of all of this, you need to consider what the competitive risk really is. This is what we're talking about. This is chronic bilirubin encephalopathy, otherwise known as kernicterus. If bilirubin levels are not treated and get to very high levels, the bilirubin can deposit in the brain at the location of the arrows in an area of the brain called the basal ganglia. If children are not treated for high bilirubin levels, these depositions cause brain damage and lead to a form of cerebral palsy or long-term neurological injury in these children. The rate of cerebral palsy, if we didn't treat bilirubin at all, would be far, far higher than over 10,000 patients treated with phototherapy to prevent one cancer. Even the systematic review that I showed you in the last part of this talk demonstrated, although there was an increased association, when you considered the benefits versus the risks, there is no question that phototherapy helps to avoid this devastating neurological injury, and it would be far more common if we didn't use phototherapy at all.